know. I'm depressed. I got no strength. Doc, I'm melancholy.
Mm-hmm. You say you were bitten by a tarantula?
10 days ago.
Mr. Carlin, I'm afraid you've got what we refer to in the profession as tarantism. According to the book, it says, a malady common in medieval Europe, believed to be brought on by the bite of the tarantula, and characterized by depression, weakness, and here we are, melancholia.
Whoa. Can you treat it?
Let's dance!
Pardon me?
According to the book, if we sing and dance until we're sore, we'll have the symptoms no more!
Hey, Doc, what are you, crazy?
Relax, I'll lead.
This is a travesty.
No, it's not. It's the tarantella. You have beautiful eyes.
You know, I think I'm starting to feel better.
Believe it or not, I'm actually curing this man.
Doctor.
I was feeling so bad. Asked my friend, my doctor, just what I had. I said, Doctor, Mr. MD, can you tell me what's ailing me? He said, yeah. All you need, all you really need, all you need is loving. Got to have good loving, good loving, baby. Doctor.
Yeah.
Doctor.
Uh-huh. Doctor.
Yeah. Is there a doctor in the house?
Yes.
I never should have agreed to let Justin have a dog.
You kill me. A big, strong guy like you defeated by little doggy.
This is no ordinary little doggy. This is Rex the Hound from hell. I feel like I've been living with Cujo.
Gale foaming at the mouth again, Abe?
It's the dog he bought for Justin. Abe can't cope.
Have you considered counseling?
I've considered the food processor.
Typical male response. You know, things get the least bit unmanageable. We just open up those testosterone jets and bam, proceed straight to physical violence.
And what would you suggest, Mrs. Gandhi?
You don't need violence to assert your dominance, Mike. You can do it with a look, an attitude. Show him who's boss.
Deirdre.
Let him know who's the master.
Deirdre.
Make him bow.
Deirdre!
What? Oh. Sorry. Where was I?
Renewing your membership at the S&M Club?
Join up now.
Hey, I still say that mud is beyond help.
Tell you what, Abe. You give me Rex for 5 days. I promise you I will whip him into shape.
You got a deal.
Doctor?
Faye.
Doctor?
Faye.
Doctor?
Faye?
Salvatore Parisi. Last night was admitted with chest pains. The hospital sent over the charts.
Oh, no, poor guy. Grant has put in a new pacemaker.
Yeah.
Okay, let the hospital know I'll be over on my lunch hour, and let me know the second Grant gets here.
Okay.
Morning, Mike.
Grant's here.
Thank you, Faye.
I live to serve.
Grant, we gotta have a talk about Salvatore Parisi.
Parisi? Parisi. I did his pacemaker. Work of art. Hall of Fame procedure.
Well, before you thank the members of the Academy, Merrill, I had the practice in Africa.
I love that film.
You should know that he's been admitted with what sounds like angina.
Angina? What is he? Well, he's abnormal on the EKG stress and the thallium scan. Did you get an arteriogram on him yet?
Yeah.
Well, I tell you, to me, he's in the same boat as Margaret Nagel. They're both bypass candidates. Let's have Faye scheduled for next week. I'll knock them both off.
Unfortunate turn of phrase.
You know
Grant.
what I mean.
Yeah, spoken like a true surgeon, born to cut. Choppity, choppity,
Look,
choppity.
this guy shows 95% stenosis in the left anterior descending, 85% in the obtuse marginal and septal branch. Same as Mrs. Nagel.
Yeah, well, Mrs. Nagel's bypass, I can understand. She's 55, but Sal's 73, and he's not a good healer. He's not bad at sitting and shaking a paw, but he's not a good healer. I say we try something a little less risky, like angioplasty.
Why? Maybe you don't improve circulation. Maybe you cause an infarct. To me, that's risky. I say we bypass it.
Don't be a cowboy with this.
Oh,
one.
now look, don't call me a cowboy. I hate it when you call me that.
Cowboy, cowboy.
I'm telling you.
Quick, put the operating tables into a circle. I don't like it. It's too quiet. Whack. Gang, 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 gang.
I just think the guy ought to know his options.
Yeah, well, I don't think surgery's the answer to everything.
Well, maybe that's the difference between you and me, Mike.
No, Grant. Moose is the difference between you and me, don't you think? Think about it.
At least I have something to moose.
I heard that!
Okay, all right, all right.
Grant, just before we go... Grant!
I'm sorry. Yeah.
Just before we go in there, I want you to know that I've known this guy for years. He's an old Italian fisherman, and he's scared. Okay, so, try and act like a friend, not just a doctor.
Mike, get out of the way. Me and what's-his-name are gonna bond.
Salvatore Parisi.
Right.
Hey, Sal, how are we feeling today?
What am I always feeling?
Any nurse you can get your mitts on, you rogue.
Hey, what's this, another doctor? We're having a special today? 2 for the price of 3?
This is Dr. Linowitz. He performed your pacemaker operation, remember?
Oh, yeah. You do great work, Doc.
Well, thank you, Mr. Parisi. It's nice to see you again.
Hey, I'm here for my heart, not my hearing. Hey, it's bad, Mike. I can't even go out on the boat anymore.
My father used to say sometimes you just gotta pull in the nets and, troll in the better waters.
Your dad was a fisherman?
Hey, I was practically spawned.
Hey, how about that? Linowitz, huh? You don't come across too many Jews in my business.
Mostly we go for salmon and whitefish.
What was the boat called? Fiddler on the Sea?
So, Sal, I got an option for you, okay? Something I think you ought to think about.
Yeah.
It could restore you to a normal life.
Yeah.
Who knows? Maybe even go fishing again.
Sold.
Okay.
Sal, don't you want to know what it is first?
Yeah, but if it works, who cares?
What I am suggesting is bypass surgery.
Hey, keep talking. Oh, this guy ever gives me his pills.
Sal, this is a tricky operation. At your age, there are risks involved.
At my age, there are risks involved in going to the bathroom.
Yeah, well, if you urinate on an open light socket, what do you expect?
Don't pay any attention to him.
Sal, you and I have been friends for a long time, and I'm telling you, as your doctor and your friend, I really don't think you should do this.
And I'm telling you, I hurt like hell. Can't even play bocce anymore.
You bocce?
Every day, the second I got off the water.
I just took the game up. It's a great game, isn't it? The smoothness of the balls, the close-cut grass, the renting of the shoes.
Sal, would you excuse us for a
Renting
minute,
of the
please?
shoes.
Grant?
Yeah.
Could you step outside, please?
Scusa un momento, miei amici. Un momento.
Vedremo, dottore.
Da
sì.
questo momento, in questo momento. Non voglio parlare.
Since when do you come from a family of bocce-playing, Italian-speaking fishermen?
I'm just trying to make Al feel
Sal.
Just trying to make him feel more comfortable. You said be his friend.
Yeah, his friend, not climbing the sack with him.
All right. So I stretch the truth a little bit. You know, it's bedside manner.
This is bedside perjury, Grant.
Look, bypass surgery is the best thing for this guy. He knows it. I know it. If you don't believe me, let's go ask him.
No, he's my patient. I'll ask him. You go soak your trigger fingers, cowboy.
Oh, Mike, I hate that.
Cowboy.
I'm telling you, it's the last time I'm
Oh, that Grant. Oh, what a card. You know, the only reason he wants to open you up is to get the pacemaker back. He's still got 2 payments to go on it.
Hey, your friend Linowitz. If he's a fisherman, I'm Burt Reynolds.
Nice weave, Bert.
Still, I tell you, I like his attitude. Confidence. Mike, can he really get me back on the water?
Grant can probably teach you how to walk on it.
I'm serious, Mike. Can this guy make me feel better?
Well, maybe he can.
Okay. then I'll do it.
Surgery's always risky, though, Sal. The heart surgery's even riskier. There's a chance you might not survive the operation.
I'll take the chance. It's better than living like this.
Come on, Sal.
Mike, it's my life. I want it back.
Peggy, you haven't heard anything about Parisi yet, huh?
Nothing yet. Nice sandals.
Oh, I thank you. They were boots. Rex had a different fashion vision, of course.
Not responding to the old "I am master, you are dog" routine, huh?
Well, certainly not like you ever did, Spanky.
Did she say spank me or spanky?
Spank me, I think. That's what it was, yes.
Nice boots, Deirdre.
Thank you so much.
So how's Tyrannosaurus Rex?
A pistol, but mark my words, by the end of the week, that mutt will be eating out of the palm of my hand.
Yeah, lady fingers.
Dr. Stratford, Dr. Lenowitz on line 2.
Oh, thanks, Faye. Hey, Grant, what's... Great! I can't hear you. You're breaking up. What's that? You're calling from the operating room? Cellular. No, I don't want to hear his heartbeat. Just close him up and I'll be right over. Yeah, Sal pulled through.
Yeah. Did you have any doubt?
Me? Nah. Well, little. It's Grant. A lot. I had a lot. You're just getting out of surgery now?
Yeah,
I thought you were closing over an hour ago.
we were. We had a complication. Thank you.
What happened?
I'm not sure what happened. We had him on blood thinners, anticoagulants,
Lost him?
pulmonary embolism. I never got him off the table. Oh, Mike, I'm sorry. There was nothing I could do. I know how you feel, Mike.
I don't think so, Grant.
I still think surgery was the best option for Mr. Parisi. I believe that in my heart.
Hell, maybe you should have believed it in Sal's heart.
Well, look, that's uncalled for.
So was a bypass.
That's your opinion. I felt differently.
Grant, I find it hard to believe you felt anything at all.
Oh, look, Mike, I'm very sorry that the guy died, but I didn't do anything wrong.
Yes, you did. You and that ego of yours talked him into an operation I told you didn't need.
Look, Mike, I know you think I have a big ego, but the fact is I am a surgeon. I have to have a big ego. If I don't think I can be perfect every time going in, I got no business pulling into the parking lot.
You're right. Can I have your space?
This is crazy. We can't fight like this every time I operate on one of your patients. Are we going to go through this again before I operate on Mrs. Nagel?
Nope.
Good.
Because you're not operating on her. I'm referring her to another surgeon.
How can you do that?
Well, I can see how shook up you are over Sal's death, so I'm bypassing you.
Mike, we are partners. You can't do that.
My patient, my referral. If I want my patients to see Sweeney Todd, I'll buy them tickets.
Jump in here anytime, guys. Really.
The heart surgeons. Todd, Sweeney, Kruger, Frederick, Gabor, Jaja. Go away unless you're a heart surgeon. Hey guys, what an unexpected intrusion.
Well, we come at a bad time?
Well, actually, I was just about to do a staged reading of The Glass Bottom Boat. And there are 2 parts as yet uncast. It all looks bad.
Hey, I told her to take that werewolf back to the pound, but she wouldn't listen.
He doesn't understand. This time it's personal. Know what I mean?
Yeah, kind of like me and Grant.
Mike, Grant didn't kill Sal Parisi.
Oh, you're right. He probably ate a bad clam.
Mike. Sal Parisi knew the risks, man. He was sick and tired of being sick and tired.
But he was alive.
He was also miserable.
Oh, so that's our jobs, putting people out of their misery? Nobody tells me anything.
Mike, what did Grant do that was so terrible?
He roped Sal into an operation I told him he didn't need.
Come on, Mike. All right, look. Put yourself in Sal Parisi's position. Before surgery.
All right, I'm Sal before surgery. Are you happy now? And who might you be?
I'm Mike Stratford, overly concerned physician.
Why not do that?
Yes, you do. You did a wake-up promise, just like that.
Hey, Grant Linowitz, scum of the earth.
I thought I recognized you, you sleaze monkey.
So, Sal.
Do I have to be Sal? Can't I be Margaret Thatcher? You stupid, stupid boy. How about Sean Connery? The jig Jacques Blofeld. I like my martini shaken, not stirred.
Mike.
It's Sal, all right? It's Sal already.
So, Sal. I see by your chart that you're experiencing chest pains and blackouts, and you're spending most of your days on the toilet with me.
Well, it's a good life, especially when there's company.
Tell you what we're gonna do, Sal. We're gonna up your dosages of Inderal and Cardizem. We're gonna continue with the nitroglycerin just for good measure. Are you experiencing any discomfort?
Nope, feel great.
Remember, you're lying in a hospital bed with chest pains.
Yeah, I remember. Oh, well, at least I'm alive, and that's what counts, right?
Sal, what would you say if I told you with bypass surgery we could free you up of medication and possibly add 15 years to your life?
Sounds great. What's the catch, as we fishermen say?
Well, you might not survive the surgery.
You mean I might die?
It's a possibility. It's your choice, Sal.
Let me see. Life, death. I choose life. Think I made the right choice? Death.
Mind living with all that pain?
Nope.
On mega doses of medication?
Nope.
In the bathroom day and night?
Catch up on my reading.
Come on, you're supposed to be Sal, not Mike.
Oh, yeah, right. I forgot. Sorry. And you're supposed to keep me alive.
No, we're supposed to try to keep you alive, which is exactly what we intend to do.
Yeah, and if that doesn't work, then what? Hey, Sal Jr., sorry about your mom, dad, and the pacemaker.
Look, I perform this operation routinely. I can practically do it with my eyes closed.
So why not use a blindfold while you're at it? Go ahead, kill my friend.
You know what? You get too involved with your patients.
So what's wrong with that?
Everything if it prevents us from doing our job.
So what happens if he dies on the table, huh?
If I can't save Parisi, buddy, nobody can.
Well, who do you think you are, God?
Next best thing, I'm a doctor.
Wait a second. Aren't we talking about my life here?
Exactly. You chose to bypass Sal.
Mike, Sal had a bad heart. You can't make that Grant's fault.
Excuse me. Hello? When did that happen? All right, tell him I'll be right over.
What?
It's Margaret Nagel. She said a myocardial infarction in the last hour.
So you're gonna call Grant, right?
No, I'm gonna find somebody else.
Mike, you're not gonna find a better surgeon than Grant.
And while you're busy getting back at Grant, Margaret Nagel could die.
I'm not letting him play God this time. He got such bad reviews his last performance.
So you're gonna play God instead?
Mike. You can go home now.
So, everything go okay?
Everything went perfectly.
Good.
Why are you still here? You didn't trust me?
No, it wasn't that. I had some paperwork to do, and the coffee here is just so darn strong.
Go to sleep, Mike.
Maybe next month. Grant, the reason I'm still here is because I wanted to tell you I realized that bypass surgery was Sal's decision. And I got angry at you because I was angry Sal died. And I'm sorry, I was wrong.
Mike, getting angry because a patient dies is not wrong. What is wrong is crossing the line. You got involved emotionally.
What's wrong with that?
Patients die, Mike. You know, you can't die for them.
Well, granted, you can only do it once, but...
And this is where we work.
Hold the phone, that's Cujo?
Rex and looks can be deceiving.
I'll say, all this time I thought you'd been backcombing your armpit hair. How'd you do it?
I have my ways.
Hey. Oh, who's a little doggy?
Your little dog.
Oh.
Say hello, Dad.
Oh, wow. Oh, Deirdre, you're a miracle worker.
No, that would be me.
I gotta take this little fella home. Gail's not gonna believe this. Oh, I owe you big, Dr. Bennett.
You'll pay.
Come on, how'd you do it? It was the icy glare, right?
Yeah, that and a couple of cc's of Librium. Which should be wearing off about, oh, I don't know, dinner time. I'm so ashamed.
You wear it so well.
I could train you too.
Grant! Hey! Want a cup of coffee? I'm afraid to stop.
Hello, Mike.
I love you, Grant. I love you.
Mike, if you have something to say, just say it.
Okay. I was thinking about what you said about, you know, how sometimes I get too close to those people with the open back gowns and then...
Patients?
Yeah.
Mike, I see how close you get to your patients. Sometimes I wish I could get involved with mine the way you do.
Why don't you?
I can't afford to. I'm a surgeon. What happens when I lose a patient? How do I go back in the OR?
So what you're saying is you have to be a cowboy?
Yes. Yes, okay, a little bit.
That's fortunate, because I got you a little something.
No.
Just happened to find a place that sold 11-gallon hats. Too bad you got a 9-gallon head. It's Bucky Linowitz.
How you doing?
My brother's my father.
Same here.
Yeah.
Daddy.
Way to go, Dad.
Okay. Thank you.